Hello and welcome. My name is Barkha Dutt. You are with the Mojo Story, our digital platform that has been taking you across India, literally reporting from COVID epicenters. And now we are, as you can see, in a rural Uttar Pradesh. We have been traveling from Kanpur to Unnao to Varanasi, and now we are in Allahabad or Prayagraj. And one of the big dangerous dimensions of this unfolding calamity is also what's happening with bodies, COVID bodies, abandoned bodies that in fact are not just floating in the Ganga, but are being abandoned, are being dumped, and now are being worked into makeshift burials in barren riverbanks. This is what we saw just now, minutes ago in Prayagraj. These are once again abandoned bodies that families are bringing in and just leaving there, no name, no COVID test, just in bulk, in the hundreds. Allahabad now becoming the latest place on the Uttar Pradesh map to see bodies that some estimates are suggesting are now running into the thousands along the entire stretch of the Ganga. Remember, this too can create a new public health crisis beyond all the moral, philosophical, and of course empirical questions it raises about whether India is actually ever going to know the exact number of its COVID dead in this second wave. Now, we have a very important, significant guest today. Let me introduce her quickly. We're joined by Dr. Soumya Swaminathan, Chief Scientist of the World Health Organization. The WHO has just said that the India second wave is hugely concerning. And Dr. Swaminathan, of course, these mass bodies that I've been reporting on are also creating many different public health issues. And before I start my conversation with you, I just want you to have a sense of what we're seeing on the ground. This is the latest report on abandoned suspected COVID bodies in Prayagraj. उन्नाव, कानपुर, वाराणसी और अब आप वही दृश्य देख रहे हैं यहाँ पर प्रयागराज इलाहाबाद में। हम जहाँ खड़े हैं आप मेरे पीछे देख सकते हैं कि वंस अगेन वी आर सीइंग बॉडीज़ बेरीड इन द सैंड और सैकड़ों की तादाद में, अगर मैं कैमरा से कहूँ तो वो पीछे जाए तो आप देख सकते हैं कि सैकड़ों की तादाद में इसी तरह की बॉडीज़ जो अबैंडन्ड हैं, दे आर बेरीड इन the barren river banks of where we are standing in Allahabad. यहाँ पर हमारे साथ पंडित जी हैं। पंडित जी आइए थोड़ा आगे चलते हैं। ये हम नदी के किनारे हैं यहाँ पर तट पे, और आप जगह जगह देख रहे हैं। इस तरफ भी अगर हम आपको दिखाएं तो आप देख रहे हैं कि इसी तरह जो शव हैं वो रेत में दफनाए हुए हमें दिख रहे हैं। थोड़ा कैमरा अगर हमारे आगे चले तो आप देख सकते हैं कि पीछे पीछे तक इसी तरह की सैकड़ों की तादाद में यहाँ पर बॉडीज़ दफनाई गई हैं। पंडित जी, आप अपना नाम बताइए।
पंडित जिलेदार मिश्रा।
अच्छा, ये जो हम देख रहे हैं, और पीछे मैं फिर अपने कैमरामैन से कहूँगी कि पीछे घुमा के दिखाए कि कितनी तादाद में इस तरह से बिल्कुल ज़मीन में, रेत में बॉडीज़ लोग आके छोड़ गए हैं। ये आप कितने दिनों से देख रहे हैं और रोज़ कितनी बॉडीज़ आ रही है?
ये
आइए
तो
पंडित जी चलते हैं।
ये तो परंपरा बहुत दिन से चल रहा है।
हाँ, कोविड, जब से कोविड शुरू।
हाँ, लेकिन इस समय तो जितने लाशें आ रही हैं, कोई जल्दी डर के मारा बता ही नहीं रहा है कि ये कोविड का है या वैसे है। आते हैं और गाड़ के चले जा रहे हैं।
आते हैं और गाड़ के चले जाते हैं। तो ये बताइए, जैसे हम यहाँ चलते हुए जाते हैं और आप देख रहे हैं कि फ्रेश हाल ही में बॉडीज़ यहाँ पर बिल्कुल रेत में नदी के किनारे यहाँ पर गाड़ दी गई हैं।
हाँ?
जब से ये कोविड का दूसरा वेव शुरू हुआ है,
हाँ?
आप एक दिन में कितनी इस तरह की बॉडीज़ देख रहे हैं?
इस तरह की बॉडी तो आज 3-4 दिन से कुछ कम हो गए हैं, लेकिन इसके पहले 70-80, 100 तक पहुँच जाती थी।
70-80 रोज़। तो ये पंडित जी हैं। पंडित जी हमारे साथ चलते रहिए और मैं इस तरफ भी आपको दिखाती रहूँगी कि यहाँ पर रेत में किस तरह से सैकड़ों की तादाद में बॉडीज़ यहाँ गाड़ी हुई हैं और कोई जानता नहीं कब ये आते हैं, कौन छोड़ जाता है। अब सवाल ये उठता है कि ऐसा क्यों हो रहा है और सरकार की तरफ से एक प्रॉपर एक्नॉलेजमेंट क्यों नहीं हुआ। कुछ अंदाज़ों के मुताबिक तो 2000 ऐसे शव गंगा के किनारे उत्तर प्रदेश के अलग अलग इलाकों में हैं। हम खुद ही 4 ऐसे इलाके खुद ही देख चुके हैं जहां हमने हंड्रेड्स में ये बॉडी स्वयं गिनी है। पंडित जी, ये क्या हो रहा है? क्या लोगों के पैसे कम पड़ रहे हैं? क्या कोविड से उनको डर लगता है ये मानने के लिए कि कोविड है?
इसमें 2 कारण है। एक कारण तो है कि कोविड से डर के लिए बता नहीं पा रहे हैं, और दूसरा कारण है यहाँ की इतनी बड़ी महामारी हो गई लकड़ी के जलाने के लिए कि जो बाहरी आदमी आते हैं उनसे 15-15, 20-20 हज़ार रुपया लिया जा रहा है। तो
इतना ज्यादा पैसा?
हाँ, तो हर आदमी तो अमीर तो है नहीं
जी।
तो जो गरीब है वो अपना गाड़ करके चला जाता है।
अच्छा, आप क्या देख रहे हैं? मैं फिर आप दिखाऊंगी कि पीछे दूर दूर तक आप थोड़ा अगर कैमरा को नीचे और ऊपर दोनों ही लाइए तो आप दूर दूर तक पंडित जी हम देख रहे हैं कि कितनी ही तादाद में ये जो बॉडीज है। एक तो पैसे की प्रॉब्लम रही,
हाँ।
दूसरा एक रहा कि लोगों को लगता है कि भाई वहम है उनको कि भाई मानो ना कि कोविड है ना।
हाँ,
ये भी उनकी सोच
हाँ,
है।
हाँ, हाँ,
तो ये क्या करते हैं रात को जो हम कभी जानेंगे ये किसकी बॉडीज है?
अच्छा, दिन में भी जो बाडियाँ आती हैं,
हाँ।
ये शो नहीं होता है कि कोविड बाडी है या ओसे बाडी है।
हाँ, मालूम नहीं।
हाँ।
जब टेस्टिंग ही नहीं हो रहा तो मालूम ही नहीं।
अभी उसका टेस्टिंग होने लगे तो
हाँ।
मालूम हो जाए कौन कोविड है कौन ओसे है, तब ये क्लियर मालूम हो जाए कितनी कोविड बाडियाँ आ रही हैं।
अच्छा, आप कितने दिन हो गए हैं, आइए पंडित जी, आप कितने दिन हो गए हैं कि आप 70-80 शव रोज आते हुए देखते हैं?
ये लमसम ये जब से कोरोना चालू हुआ है, आज पहली लहर में तो कम था।
हाँ।
लेकिन दूसरी लहर जब से आई है, उस लहर से आज 4-5 दिन से तो कुछ कम हो गए हैं, नहीं तो 70-80 बाडियाँ रोज आती थी, पूरा मेला यहाँ लगा रहता था।
अच्छा, एक बात बताइए, बारिश जब शुरू होगी तो और प्रॉब्लम होगा?
प्रॉब्लम ये होगा कि जब बारिश शुरू हो जाएगी तो ये जो गाड़ के गए हैं ये पानी से ऊपर आ जाएगा,
फिर और बीमारी फैल सकती है,
तो ये बहना शुरू हो जाएगी,
बॉडीज बहना शुरू हो जाएंगी।
तो ये जा कर के कहाँ कहाँ लग रहा है, किस किस किनारे लग रहा है, वही बीमारी का घर बन जाएगा।
बीमारी का घर बन जाएगा। ये अब एक और पब्लिक हेल्थ प्रॉब्लम होने वाला है, जैसे पंडित जी हमें बता रहे हैं। और वो ये भी बता रहे हैं कि यहाँ प्रयागराज में इसी तट पे, इसी जगह पर वो देख रहे हैं कि ऐसे भी दिन रहे हैं जहाँ 70 से 80 बॉडीज़ हैं। और पंडित जी आखिर में मैं बोलूँगी, जब हमारे देश की कोविड की गणित की जाएगी तो हमें कभी पता लगेगा कि ये किसके शव थे, कौन थे, ये कोई इंसान था, कौन था, क्या नाम था इनका?
ये कैसे मालूम हो पाएगा?
ये कहाँ से शव आ रहे हैं?
कैसे मालूम? अभी तो इसके लिए वहाँ पे एंट्री होना शुरू हो जाए कि कहाँ की बाडी आ रही है, ये लिखना शुरू कर दें, और ये कोविड बाडी है या उससे मृत बाडू है तो उसमें कोविड भी अलग हो जाएगा, और कहाँ कहाँ की बाडी सब एंट्री होना।
ये कोई गिनती कर रहा है क्या?
कोई नहीं गिनती कर रहा, सब आ रहे हैं, सब अपना गाँव।
कहाँ दूर दूर से आ रहे हैं?
ये प्रतापगढ़, सुल्तानपुर, जंघई, मछली शहर
और
जौनपुर।
कितने बजे, दिन के कितने बजे आते हैं लोग?
ये सर ये सुबह 7-8 बजे से चालू हो जाता है,
और कोई नहीं जानता ये कौन है? कोई नहीं जानता ये कौन है, कब इनकी गिनती की जाएगी, कब हमारी सरकार की तरफ से एक एक्नॉलेजमेंट आएगा कि ऐसा हो रहा है। अब तो हम 100-200 क्या बात करें, अब तो हम हज़ारों की तादाद में बात करने लायक हो गए हैं, क्योंकि हम खुद ही 4 इलाकों में देख चुके हैं। हमने शुरुआत की अपनी सफ़र से कानपुर, उन्नाव, वाराणसी, और अब हम प्रयागराज में हैं। और मैं आपको आखिरी विजुअल यही दिखाती हूँ एज वी ट्रैक इंडियाज़ अनकाउंटेड abandoned COVID bodies that are either being dumped in the rivers or are being buried in the sandbanks in areas like this one. This is the question before us as people today. Who is counting our dead? Why is our state, our institutions not even acknowledging the scale of what is happening? Okay, so Dr. Swaminathan, these are disturbing reports coming from the hinterland, and they raise not just moral questions for public health experts, they also raise health issues. As you know, as a medical practitioner, we are going to be looking at the monsoons. We have bodies in thousands floating in the rivers, by the riverbanks. First, your overall assessment of where India is with the second wave.
Thank you, Barkha. They are very disturbing and distressing. So I would like to say a little bit about what I think can be done to address the situation that you've been witnessing. But first, on the second wave, WHO is very concerned with the kind of increase that we're seeing in India, just as we have been concerned about other countries. India is not the only country in this situation. Because of the population, of course, it is very dramatic. The numbers are very, very high. Now, while we are seeing a plateauing over the last couple of days, what is likely to be happening is that while some states are getting things under control and new cases are reducing day by day, like Maharashtra, for example, there are other states which are still going up, and there are other states which are still at an earlier stage of the wave where things have not yet peaked. So, looking ahead, I see that we have several weeks, if not months, ahead of having to apply these very strong public health measures in every state in India. Those who are at an early stage, those who are on the rise, as well as those who have turned the corner and seem to be coming down, in order to contain new infections, because unless we control that, we cannot reduce the number of deaths. The number of deaths is going to be directly proportional to the number of new infections. So it's going to be a difficult few weeks ahead of us, very critical few weeks. And this is the time to really double down and do everything that we can do to, first of all, make sure that we take care of those who have already got the infection, who are sick, prevent them from getting really ill. And if they get ill, we need to treat them appropriately to reduce the mortality. And secondly, we have to do all the other measures that we know work, which are tough to implement, but it has to be done. And one of them is going to be scaling up testing, particularly in the rural areas.
When you say that we might be peaking, is it your sense that the worst is behind us, or do you think that we are looking ahead at the worst to come in this month of May and early June?
Well, I would very much hope that the worst is behind us, but what I was saying is that I'm not sure that we're over the worst because of the huge population of the country and the geographic heterogeneity and the fact that different states are at different stages of the curve. We may have plateaued, but that doesn't mean that we will soon be on our way down, in terms of national numbers. The big states, of course, do contribute more, proportionately. So when the big states do well, you will see an overall impact on the national figures. But that doesn't mean that things are getting under control everywhere.
You have been talking about the advisability of a national lockdown, and that has been the biggest difference in the response this year from the first year. And obviously, India was a bit, reeling under the economic consequences of that lockdown. Right now, the lockdowns have remained localized. Is that working, or would you push for a national lockdown?
I think the state level lockdowns are working. From what we've seen happening in Maharashtra, for example, which is a really large state and which faced a very big epidemic, and the curve actually started going up there, several weeks ahead of Delhi. I think we've seen that you can turn things around in a city like Mumbai, in a large state like Maharashtra, with the measures that have been employed. Other states now in the south have all followed as well. So I think, again, being such a large country, it's really difficult to have like one set of rules for everybody. It has to be contextualized. Some states are more urban, some states are more rural, some are more tribal. Some still have low rates of infection. So I think a more granular approach at a state level, and in fact, we need to go much further down. We have to go down to the district and the sub-district levels, especially in the kind of area that you're reporting from now, to really understand the epidemiology of the disease there and to take some policy actions.
I want you to talk a little bit about the mutant. In fact, I remember Dr. Siddharth Mukherjee on my program said it's a misnomer to call it the double mutant. We actually have identified one particular strain, which is much more transmissible, which is causing this catastrophe in the country. Can you talk about what we know about this mutant strain? And the big question that everybody is asking is, how are the vaccines performing vis-a-vis it?
So, what we do know about the B1.617, which was first described from India but is now in over 50 countries, is that it is highly transmissible. I think there is no doubt about that. Even looking at the way in which this strain has outcompeted the B117, which was first described in the UK, and which was a predominant strain in India till a few weeks ago. The 617 is now becoming predominant across India from different states. And as our genomic sequencing capacity is increasing, we are getting more and more and better data from different states. So on transmissibility, it looks like it's about 1.5 to 2 times more transmissible than the original SARS-CoV-2 virus. On the clinical profile, there's some early data from animal studies showing that it can cause more severe pneumonia in hamsters. But we need data from people, from humans. And so I hope that some good studies will be done to really document whether the clinical severity is different from what we saw last year. And thirdly, on the vaccines, again, there's limited data, small numbers, it's laboratory studies showing that the antibodies that are in people, either due to naturally being infected earlier or by vaccination with Covishield or Covaxin, that the neutralizing ability of those antibodies is slightly reduced against the new strain, the 617, compared to the original strain. But because antibodies stimulate such a big immune response, a strong immune response in the body, which is both neutralizing antibodies and the T cells or cell-mediated immunity, at the current time, I think most scientists believe that the existing vaccines will still work, will still protect against the new variant. But we need more research, we need more studies to document that in larger numbers in India.
In India, we have in fact seen cases of people who've been doubly vaccinated and still got the infection, but in most cases, not severely. Are you saying that at the moment vaccines are working, but not as well as they have with other variants?
It's too early to say that. From the laboratory, what we know is that the neutralizing antibodies impact on this strain seems to be a little bit less than it is on the original strain. That doesn't mean to say the vaccines are not working or will not work. I think people need to understand that vaccines are not 100% protective, especially against infection. What they do is generate enough immunity to protect you against severe disease. So, as you rightly said, even after getting 2 doses of the vaccine, you can still get infected. And there are many cases. Everybody knows people who've got infection after 2 doses of the vaccine. So that's not unexpected. But the majority of those are mild, relatively mild, and do not end up being, severe or requiring hospitalization, and definitely not ending with death. That's what we want to avoid and prevent. And so vaccines are highly effective against preventing severe disease. They will not protect 100% against infection. That's why it's still important to keep the masks on, to maintain the distancing, and to do all the other things, the respiratory etiquette and all of that we've been doing for all these months.
One of the things that epidemiologists are worried about in India is that given the scale of the infections, you could actually see new mutations. We don't know. Is there any way to anticipate that? What is the kind of genome sequencing data we have out of India? How much do we know about what's going on with these mutations and these strains?
You're absolutely right that the more the virus multiplies, replicates, transmits, the more variants will emerge, the more mutants will emerge. So over the last 17, 18 months, we've seen this virus changing and some strains becoming more predominant. So that's the same thing was noticed with the 117 in the UK. There was a sudden upsurge of cases. We saw in South Africa, the 1351 doing the same. We saw in Brazil, the P1 strain, which could actually even infect people who'd had the infection before. This is the normal behavior of viruses. This is how they evolve. What we need to do is not give an opportunity to the virus to evolve, because the more it mutates, there are chances that at some point those mutations the virus may become resistant to the existing vaccines that we have, if the right combination of mutations come together. So far, it has not happened. But we have to prevent that from happening. And the only way to prevent that is by controlling this kind of widespread transmission, not just in India, but across the world.
How how alarmed are you at the low rate of vaccination? You see, normally, if you look at how the world dealt with this, when the UK, for example, was in lockdown, it took that time to vaccinate a large section of the population. We are 41% down in our vaccination rates, and we clearly have an acute shortage of vaccines. We are in the last 24 hours at 17 lakh vaccine doses administered, whereas we need that number to actually have been 70 lakh instead of 17 lakh. Dr. Swaminathan, given those vaccination numbers, what good is this localized lockdown going to do if we can't vaccinate enough people in the meantime?
Yeah, I mean that's a right question. It's a good question. It's a tough one because the supplies of vaccines currently are limited, and so I think that is the limiting factor. Not that India cannot vaccinate more people if there were more supplies. So while the existing companies are ramping up their production, uh, new contracts have been made with other companies to also start manufacturing the Covaxin. That's going to take time. It's going to take a couple of months. So right now, I think the focus, and I know that the government is doing its best to get vaccines from outside, get companies to send vaccine countries to send vaccines to India if they have excess doses, and also to negotiate with companies and get as many doses in as possible to start to increase the pace at which we are proceeding. But having said that, because again we have such a large population, um, even however fast we vaccinate, however much we ramp up, it is going to take several months to get 40-50% of the population of India vaccinated. That's kind of coverage that we need to do to start seeing good reduction in infections. So to get there, I mean, we have to go as fast as possible, but realistically it's going to take, let's say, 6 months. Meanwhile, we will have to keep in place the public health measures, not necessarily the lockdowns, but a smart strategy to keep infections under control. And that smart strategy has to be driven by data, local data, and it has to be different from urban, from rural, from state to state. But the principles remain the same. The testing, the isolation, and the care of people who are infected, keeping a surveillance to make to know how much transmission is going on at the community level, equipping the health centers and hospitals to make sure you can take care of those who get ill so they don't end up being very, very sick, while at the same time vaccinating the priority groups first to make sure that those people are protected against the infection, and thinking of maybe different strategies of vaccinating as well. But it's difficult because you're just limited by the supply of vaccines. And again, Africa is in a worse situation today where less than 1% of people, and not even healthcare workers, have all been vaccinated. So this is really a global problem, and there needs to be a very serious global discussion on solving this issue, both to help India but other countries as well.
I'll come back to the vaccines, but in the absence of enough vaccines, governments are creating medicine kits. And there's a huge amount of debate over the medicines we're administering. I know you've spent some energy urging state governments not to use ivermectin. You've even shared the press release of the manufacturer's Merck to say it's the wrong medicine. But we continue to actually see now it being included in part of what could be rural India's templated medical kit response. We have seen similar debates around remdesivir, around azithromycin. So I just want you to walk us through some of the bad science, some would say, that is being applied in a panic situation in India one by one. So let's start with the ivermectin.
Evidence-based guidance and treatment prevention is really the way to go. And what we've tried to do at the WHO is to update our guidance as often as possible based on the emerging data. So we have something called the living guidelines that we update, whenever some new evidence comes out. So we've got guidance on, hydroxychloroquine, lopinavir, ritonavir, interferon, ivermectin, remdesivir, and all of these, the evidence does not support its use, on a wide scale for people infected with SARS-CoV-2. The one drug that has a a big mortality benefit is simple dexamethasone, corticosteroids, given at the right stage of the disease, because COVID-19 is a viral infection. As of now, we have no antivirals that really act very dramatically on this virus, and they would need to be given in the early stage of the disease. We're hoping that there are some antivirals in development that will come very soon. So in the early stage, you can use monoclonal antibodies, again, still under research, antivirals. In the second phase of the disease, that's the anti-inflammatories which act, because that's where the lungs are getting blocked with inflammation and people's oxygen levels are dropping. That's when steroids help. And anti-inflammatory drugs, the anti-IL-6 inhibitors, they help. That's when patients need oxygen. So what's life-saving? It's oxygen, it's corticosteroids given to moderate and severely ill patients, and perhaps the anti-IL-6 inhibitors. None of these other drugs that's widely being used, including antibiotics,
You
has
would
any role.
and the azithromycin and the ivermectin and the Fabiflus that are now being given as set-based templates, you would say none of these need to be given or should be given.
There's no evidence that they have any impact on the disease progression. So I would rather spend those resources on giving people good quality masks to wear. In the absence of vaccines, masks are the only vaccine. If everybody wears good quality masks, properly covering their nose and mouth, that is going to make a big difference at the community level. And then, of course, spend resources on ramping up oxygen and other supplies that you need in the hospital, getting the workforce there ready. You will have to supplement the workforce because the existing doctors and nurses are not going to be enough, to cope with the kind of load that we've seen. So those are the kind of investments that need to be made. And, these drugs really, that's not going to be the ones that have an impact.
Okay, I know you're on limited time. I just have one more question on the drugs and then we'll do the overall picture. Remdesivir and plasma therapy. These are two, again, obsessive things that continue in India. Your last word on those.
Again, we don't have WHO guidance on plasma therapy, but a large trial which is just reported, the recovery trial, in a very large number of patients showed clearly that plasma therapy is of no benefit. The ICMR trial many months ago showed the same thing in India. So plasma therapy, again, there's poor patients running around, trying to get plasma for their relatives. I can understand the desperation, both on the side of patients and on the side of doctors, to just do something, do everything possible, to save your loved ones. But unfortunately, using these unproven therapies doesn't help, to save lives. So what's really critical is oxygen at the right time. So monitoring of people, making sure they get oxygen when they start desaturating, they get the corticosteroids at the right time, they get, ICU care and ventilation, supportive care at the right time. That's really important. And I think ongoing research. So again, India has a large number of scientific institutions. There are a number of early leads that different labs are talking about. All of those need to go through clinical trials and should be tested to see whether they have. We desperately need better treatments for this virus. We don't have. And so that should continue. But in the meantime, it is really the approach of testing, identifying people, following them up, monitoring them, getting them into care. The majority of people will not need to be in hospital, obviously. They can be managed at home. But the ones who need to must get there. And that's the only way to reduce the deaths that we're seeing happening now.
Our doctors are warning of the third wave hitting children, even while we're living through the second wave. The science on this is also divided. I know that this is an area that you follow closely. What is your own reading of COVID in this phase in India and children?
So the reason we are seeing younger people, there are several reasons why we're actually finding more infections in younger people and children. The first is that the older people, they protect themselves more because they saw last year, the first wave, that they took the brunt. So older people are protecting themselves by not going out, etc. Younger people, either through necessity or otherwise, are going up and about. Many colleges reopened, schools reopened in states. These all added to the infection among young people. Secondly, the vaccination program has also started with the healthcare workers and the older people. So again, older people are more likely to have received a vaccine than younger people. So for this reason, and the third reason is more awareness and testing. Many more children are being tested in this wave than they were last year. So there's greater awareness. And this more transmissible variant is actually, once it gets into a family, it seems to be infecting everybody in the family, including the children. So these are the reasons why we're seeing more infections in younger people. And as we continue to vaccinate older and coming down gradually down the age groups, of course, then you're left with a younger population who are still susceptible to the virus. And that's probably why people are saying the next wave may impact children. But I hope that we can do without a next wave. And I think we can, because what we are going through now, and we learn from this to prevent the third wave from coming, that would be the best approach, according to me.
I do want your sense on how we should respond from a public health perspective to the abandoned mass bodies that we're seeing in the rivers and by the riverbanks, and what we need to be cognizant of from a health perspective when we're looking at these images.
Yes, I mean, I think safe disposal of bodies, is definitely a priority. And I think, what you were showing in your films, I mean, that's very disturbing. And it could be a public health hazard as well, especially if the water starts rising. So there has to be, I think, a strategy now for safe disposal of these bodies, but also perhaps a large scale communication campaign in this area about what support can be provided through government, through NGOs for people who need, whose loved ones have died and who need them to be cremated or buried. Can there be some support that's given so they don't have to come and leave them, by the riverside? And the third is to tackle the stigma and discrimination associated with this infection. I think it's clear that still in some parts there's a lot of fear. Fear leads to stigma and discrimination. So I think that needs to be addressed as well through big IC campaigns. So it'll have to be a combination of these, and the district administration would need to look into how best to approach this. I think roping in community leaders, local NGOs, civil society is probably the best way to raise awareness and to prevent people from taking these desperate measures.
A last question. Are we going the Brazil way? Are we looking at a prolonged few months of the second wave where we are possibly, some modelers say, going to lose 1 million more lives? What keeps you awake at night when you think of your home country, India? Do we see an end to the second wave? Do you see it? Or are we destined to live, having missed it, not prepared properly for it, made mistakes with mass congregations, not ordered enough vaccines? Here we are. What do you see in the months ahead?
So, like I said in the beginning, I think this is what worries me, that the infection starts spreading in states which have relatively weaker health systems, less capacity, less human resources, less testing, um, and and therefore then the wave continues rather than reduce. So you get into a plateau. This happened in Brazil, it happened in other countries. But we can prevent that, we can stop it. There is nothing to say that that has to happen. So we know what needs to be done now, and we just need to make sure that every state gets the support needed to prepare themselves now, even before they come to the worst part of their peak, so they don't have to face this. So the oxygen supplies and other medical supplies, the workforce, everything, perhaps mobile facilities which can go from state to state. As things get better in one state, it moves to another state. Tele-mentoring and telehealth, training the workforce in places who don't have much experience, our rural doctors, PHCs, using digital platforms, to support them to manage patients. And I saw a tweet this morning that a few states, Gujarat, Chhattisgarh, they're actually doing this to improve the clinical management of people. Massive, big awareness programs, ramping up diagnostic testing, and all the while trying to ramp up vaccination as well. I think we need to do all of this going forward for the next several months in order to make sure that we contain this.
I mean, rural India is going to be the next fault line. Your advice, the one bit of advice you'd like to see the government following or doing more of?
So the interventions, are multiple. Unfortunately, there's not just one thing that you can do to stop this. It's complex. We know that you have to change people's behavior. You have to support them in order to change behavior, which means that people who have lost their jobs and livelihoods will need to be supported in order to stay at home and to stay safe. So you have to look at the social aspects of this. You ask me what worries me a lot. It's the impact on our children, particularly the young children. What's going to happen to their nutrition, what's happening to the other essential health services as well. So there are a whole lot of things to think about. But I think if you focus on containing the infection, then other things will fall into place. So for that, we need the public health measures. So testing has to be ramped up. Antigen tests can be used at primary healthcare, particularly in rural areas where PCR may not be widely available. Syndromic management of people. Really taking, I think, communities and engaging them is the way to go. I mean, I think there are so many examples around the country where villages, have decided how they want to keep their village free of COVID. So if every village has a strategy, every district has a strategy, I think this can be one. But it needs an all of government and all of society and community approach.
Dr. Swaminathan, it's been a pleasure talking to you. And there's so much, there's so much to worry about. But I just hope that we are able to get through somehow the next few months. They're going to be critical. We're at a critical stage in this fight against the second wave. Dr. Soumya Swaminathan, Chief Scientist of the World Health Organization. Pleasure having you with us, and we'll get you back soon as we track the second wave through rural India. Thank you very much, ma'am.
Thank you, Barkha.
Thank you.
It's great to see you here. Thank you for watching our work. If you haven't subscribed yet, don't forget to click the bell icon and subscribe to Mojo Story and support independent, robust journalism.